Welcome to Pinoy Medical Coder. Today, we'll discuss about Certified Professional Medical Auditor or CPMA. Before we begin, please don't forget to like our Facebook page and like and subscribe to our YouTube channel. Medical auditing is a critical piece to compliant and profitable physician practices. Whether it's recovery audit contractor, RAC, audits, private payer denials, or just peace of mind, more physicians plan to have audits conducted regularly. The risks of being non-compliant with documentation and coding are too great. As a CPMA, you will be able to use your proven knowledge of coding and documentation guidelines to improve the revenue cycle of nearly all healthcare practices. Earn an impressive salary as a CPMA, with tighter regulation on reporting healthcare services and payer compensation for those services. CPMAs must have a clear understanding of when a practice is at risk for non-compliance. That is why CPMAs are valuable to healthcare practices and organizations. They help keep healthcare providers out of harm's way of fraudulent activity. According to AAPC's 2018 salary survey, the average salary for a business of healthcare professional was $51,426. A CPMA's earning was much higher at $66,886. This average fluctuates depending on location, years of experience, how many credentials held, and the employer type. Certified CPMAs demonstrate expertise in medical documentation, fraud, abuse, and penalties for documentation and coding violations based on governmental guidelines. Coding concepts, scope and statistical sampling methodologies, medical record auditing skills and abstraction ability, quality assurance and coding risk analysis, communication of results and findings. The medical record. The CPMA examination. 150 multiple choice questions, proctored. 5 hours and 40 minutes to finish the exam. 1 free retake. $399 or $530 for foreign takers, outside US. Open code book, manuals. The CPMA exam thoroughly covers medical record standards and documentation guidelines, coding and documentation compliance guidelines, coding and reimbursement concepts, scope and statistical sampling methodologies, medical record auditing abstraction, category risk analysis and communication. The majority of the questions are presented in multiple choice format covering auditing theory, legal and regulatory issues, NCCI, RAC audits, statistical sampling, coding concepts, and modifiers, etc. In addition, each test taker will need to audit approximately 20 healthcare cases. Exam requirements. While there is no experience requirement, we strongly recommend that the candidate have at least 2 years of experience in medical auditing. Please be aware that this is a difficult, high-level examination which is not meant for individuals with little, limited or no audit experience or training. Other requirements. We recommend having an associate's degree. Pay examination fee at the time of application submission. Maintain current membership with AAPC. Renewing members must have a current membership at the time of submission and when exam results are released. Renewing members must be current at the time of application submission as well as when results are sent. Materials to bring. Current CPT, AMA standard or professional versions only. ICD-10 CM. HCPCS Level 2. Exam recommendation. The CPMA examination is recommended for a certified coder or medical record auditor who has experience auditing physician services or significant coding experience and is well versed with a variety of different types of audits, including but not limited to E&M services. Auditing involves compliance and regulatory issues in its day-to-day work, and the examinee will be tested on these concepts in addition to coding, modifiers, NCCI usage, and more. Maintaining certification. Membership is required to be renewed annually, and 36 continuing education units, CEUs, must be submitted every 2 years for verification and authentication of expertise. For CEU requirements, please see our CEU information page. Note: each examination is separate and distinct from one another. To obtain all certifications, each examination must be taken separately and passed. An overall score of 70% or higher is required to pass an exam. For examinees who do not pass, only the areas of study or categories with a score of 65% or less are provided for examinees' preparation. The areas of study reported reflect scores based on the number of questions in each category or section of the exam. Each of the category or section may vary in the number of questions asked. Continuing education unit or CEU submissions are required for all certifications. For more information, you can check the reference below at the AAPC website. Thank you for watching.